some people just have more predisposition because of their genes to having problems. Weight is a great example of that.
Isn't that always the answer, though? That you should just do more? Like, is anyone ever doing too much exercise?
Yes.
Probably not.
You probably need to have some type of dose response to understand how much exercise is optimized for your particular goals.
Welcome on in to the Health Elevated podcast. I'm the host, Dr. Fowers, joined by Dr. David Hedges. And today we have a special guest. His name is Dr. Benjamin Horne. He's an adjunct clinical associate professor at Stanford University and a professor of medical research at Intermountain Health. So, Ben, Dr. Horne, as a genetic epidemiologist, how much do our genes actually influence our health?
Well, that's a great question. And the short answer is, at present, we actually don't completely understand that. And there's a lot of research going into that. We're trying to understand what is it about our genes that is influencing our risk of poor health outcomes. And for the long answer, I will go into the long answer. The medium length answer is that it's different for every individual. Some people have rare mutations in their genes that cause substantial problems. Other people have many different common mutations that are not really causing much difference, but together, when you add them up, they add up to significant risk. On the other side, there are some people that have a lot of common mutations that protect them from different diseases, and it really varies from disease to disease. So there's a lot of variation out there among all of us, and it's something that we're trying to capture using modern technologies, modern genetic technologies, but it's something that we're still working.
So if someone were to say to you, I can't get healthy because I just was born with bad genes, what would be your response to that?
Well, I think, as with most things, you've got to work at it, and for some people, it's more true than others. That's not a wrong statement, and some people just have more predisposition because of their genes to having problems. Weight is a great example of that, because it seems like almost all of us are trying to lose weight at some time or another, and some of us have more weight. And it turns out some people, it's not necessarily that they need to lose as much weight as someone else to become healthy, and so that the right amount of weight for an individual actually varies depending on what your genetics are. And so there's a spectrum of answers to that question, because for some people it's really difficult because of their genetics. For other people it's difficult because they have lifestyle factors that they're just not willing to change. So it's a really individual, personal question or problem that poses.
So Ben, as you know, for my master's degree, I spent quite a bit of time studying computational genetics, and it's complicated. You need to have a lot of data to start to parse out what's going on, and you need to have it on a lot of different people. And you look at a country that's diverse as the United States genetically, and that just makes it even harder to really understand what's going on, understand disease in context of genetics, in context of lifestyle. You need a lot of data to be able to parse through that, and you also need a lot of computational power as well. So before we can even get to that point, though, because we're potentially decades, potentially centuries away from having that kind of data resources, those kind of data resources for the whole population. So at what point is knowing your own genetic limitations a hindrance to your overall happiness, or your overall health? Or is it like, at what point should you be aware of, your genetic risk factors? Or should you just try to accept where you are genetically and do everything in your power to optimize your health from there? I mean, because we don't know the relationship between a gene, 10 genes, 1,000 genes, and your health. So how could the average consumer understand their health in context of their genetics? Or is it even worth it?
From a perspective of happiness, it depends in part on, can you do something about it? Or is knowing what the risks are just going to make you worry, where some of the risks won't bear out? For some people, it's a risk, but it never ends up actually happening. And again, we don't completely understand why. Some of it is probably differences in behavior and lifestyle choices and environment and so forth. And some of it is, what other genes do you have that might be protecting you, where somebody else might have a risk factor that you have, and they don't have the protective genes. So if you can do something about it, I'm all for knowing if you have the risk factor. If you can't do something, if the disease doesn't have a treatment, or if the treatment is harmful or so forth, it could be, in some situations, something that you wait until later in life to find out. And I mean, we're doing a lot of research, and so maybe by the time you find out that you have something, we will have a treatment, and you'll have 20, 30, 40 years of not worrying about it, and then you'll find out, and then the treatment will be available when it's not available now. So there's a lot of dynamics in the questions about genetics today, because there are some things we don't know. There are some things we do know, and we have to be cautious about the ethics and helping people to be happy and not worry about things that none of us can really control.
I'm wondering if you can get into some practical, tangible examples, because I know in some of your research, you helped develop this polygenic risk scores, if I'm saying that right. What is that? How does that play into some of the stuff you've just been talking about?
Yeah, so a polygenic risk score is something where we take a lot of information from across the whole human genome, and we add up all the risk genes and all the protective genes and see where is someone just overall based on all of their DNA. Are they at risk of a disease or a health outcome, or are they protected compared to the average? And so it's something where we've only been able to do it recently, and we're still actually trying to figure out, how do we use this? How do we create them? What diseases do they work for better? And where are they useful if we actually test the genes and calculate the polygenic score? Is it useful for predicting what will happen in the future for someone in their health outcomes? It's still a conundrum. So we're actually not at a point in most polygenic risk scores to be using them in medical care, because it's still something we're working out in research. One of the fascinating things is medical care, medical testing in particular, has been identifying information for the last half century on pieces of information that we would call phenotypes. They're the consequence of the genes. They're the expression of the genes. Medical care, the medical system has been identifying and implementing clinical laboratory testing that identifies those expressions of our genes. And they've done a really good job at identifying the biomarkers of organ system changes and circulation and so forth that can characterize our general health quite well. And we can make risk scores that don't involve genes, but involve these expressions of the genes using proteins that are very common, including things like markers of our circulation, hemoglobin, and white blood cells, and platelets, for example, platelet count, and other things like blood sugar and creatinine and so forth that can help us. Those are determined by our genes, the levels to some extent, and then they're also determined by our environment and the health choices, the diet, the exercise, and so forth that we do. And then also by some of the diseases, and those can help us even though we don't actually test the genetics.
So in a lot of your recent research, you've actually explored those links between those blood factors and kind of like that routine blood work with effects on near-term and long-term health, correct?
That's right.
Would you feel then, because like you previously said, like, with the complex genetics, if it's actionable, it's worth knowing. Do you feel that the results from kind of doing risk scores based on blood work, is that more actionable than genetic risk scores, or is that, still kind of quite complex and we don't know quite what to do with it?
It's actionable on some levels. And so in a medical care setting, such as a hospital or in an outpatient clinic, there are circumstances where it is very useful, especially for physicians and other healthcare professionals, to understand what is your level of risk for some outcome and or for some future diagnosis. And so we can use those risk scores using the standard clinical laboratory tests to summarize someone's current level of risk for those outcomes, and then try to modify that, which may be just encouraging them to do preventive factors like preventive behaviors like exercise a sufficient amount, or eat a healthier diet, or stay away from air pollution or so forth, stay away from cigarettes. And then in the medical environment, they can also use them to modify your care plan. If you have a chronic disease, the physician can say, this risk level is sufficient level that I need to do something extra. I was going to consider this patient just kind of an average risk, that this risk score bumps up my estimation of their risk, and so I want to increase the dose of their medication, or I want them to come back in 3 months to my clinic instead of in 12 months, or so forth. There are things that can be done. I want to order another diagnostic test to see if there's something going on. I suspect there's a heart problem, but I wasn't sure. I thought they weren't low risk. I thought they weren't high risk until I got the risk score. And so there are all these choices that can be made, and the risk score might push the assessment of risk up over a threshold where you want to do something differently. On the other hand, they can also reassure and say, this person is so low risk that you can just do what you would normally do, give them the medications they normally would receive, or maybe not give them the medication because they're so low risk, and be confident about that and move forward with their health care, and then save them some grief, some potential adverse effects of the medication if they don't really need it, or save them a trip to the doctor if they only need to come back in 2 years from now rather than in 1 year.
So with those lab values, do you look at just the absolute value of in kind of a snapshot reading, or do you look at trends to perform a lot of those evaluations?
We've done a lot of research, and others have, on snapshots at one time of assessing the values. We're starting to move into that repeated measurement over time, and find that while the most recent assessment of the laboratory factors gives you the best picture, that actually having that historical information of what were the labs 1 year ago or 5 years ago actually helps you to understand the context of where not only where they are now, but where are they going? Because if the snapshot 5 years ago said they were high risk, and now the snapshot says they're moderate risk, that helps you understand that the preventive and treatment plan that you've had to help them reduce the risk appears to be helping them, and that they should be confident in continuing to do the level of exercise that they're doing and to take their medications and so forth.
Okay. For a lot of this, excuse me, I'm just thinking, when it comes to behavioral stuff, right? Like, everyone needs to be exercising, sleeping well, drinking water, eating right, all those behavioral things. And so at some point, it's kind of like, why do we need the genetics to tell us that we should be exercising more? We already know we need to be doing these things. Because when I look at the benefits of genetics or research, the thing that I think that it can impact the most is more of treatments, probably specifically not the behavioral treatments. Well, I take that back. I think there's like treatment as in like an intervention to help people create and stick to behaviors long term. But I think the kind of bigger area and one of the biggest buzzwords comes from the pharmacy, right? Pharmacogenomics, right? Tailoring medications for a specific person. Because how it works now is everything is done by randomized controlled trials. And it shows that like certain drugs have some kind of effect on average for a certain person or for a group of individuals. But within each person, you might not represent that average, and so it might not work exactly right for you. This is called treatment heterogeneity. And so pharmacogenomics comes along and tries to tailor that at the gene level, right? So, right. Okay. So I'm kind of thinking here, if we already know that we all should be doing the healthy behavior, isn't the benefit of genetic research therefore more focused on kind of medications and things that we don't know, or things that we can more personalize for an individual?
Well, it certainly speaks, the genetics speak to the personalization, and so that gives you such a large amount of additional data. It helps you to really individualize the information to the person based on what their DNA sequence tells us. And it's something where we're still working it out. It hasn't really moved that much into clinical medicine because it is so complex to identify that individual level of personalization. For some people, though, it may be that they need more exercise than the average person. And so the amount of exercise that your physician or personal trainer or whoever you work with on that, the amount that they say you should do is based on a population average, an average for a group. You might need more to actually activate the benefits of the exercise. It goes back to the earlier question where someone's trying to change their health and it just doesn't seem to be working. It may be that on a personal level, individual level, they need to do something more. They need to do something where it has a higher dose of exercise or so forth. It does really speak to the medications,
isn't that always the answer, though? That you should just do more? Like, is anyone ever doing too much exercise?
Yes.
Probably not that often.
Definitely.
You both say yes.
You can harm yourself.
I don't think over-exercise is a problem very much. Maybe for a very small group of people.
Probably, yeah. Well, I think one thing that you said is really interesting. It's like the pharmacogenetics, kind of the concept is, your body, you take a drug, the drug is active in your body for a certain period of time, and then the effect wears off. Because the drug is either expelled from your body or, it's broken down through your own kind of internal metabolic processes. So drug is metabolized or expelled. And the rate that happens is different across different people. That's kind of like the core concept of pharmacogenomics. Is that correct, Ben?
That's right. Yeah.
So one thing that you said that was really interesting is relating that back to exercise with this idea that you probably need to have some type of dose response to understand how much exercise is optimized for your particular goals. So I think earlier we talked about this concept of, um, how much do genes, I have bad genes, I can never be healthy. And that's, I kind of somewhat disagree with that, because I would say, like, your definition of health really should depend on your goals in the here and now. You need to accept your background, accept your baseline, and then it's up to you to be empowered and encouraged to really figure out how to optimize your health and decide what your health goals are, for where you are. For some people, that could be, powerlifting. For some people, that might be going out for a walk in the evening. For some people, that could be, improving your diet. And that's really up to you to decide. So within context of this, almost like a dose response, it seems like you'd probably have to have a significant amount of experimentation in your own life to figure out how much and what kind of exercise is going to give you the results that you want, in addition to all of the soul searching that you have to do to understand what health results you're looking for, which this almost just seems like way too complex for an individual to figure out on their own.
Takes a lot of time. Yeah, I'm sure that we all know somebody or multiple people who do that sort of empiric testing to see what is best for them, or how much do they actually enjoy of that dose, and do they feel the response, and so forth. And you can spend a lot of time doing that, and you may not figure it out in the end as part of the problem. And so there is this potential role of having some level, some measure of what is your individual risk that can help you figure that out without having to do a lot of experimentation. But it's something that if we have more information, and we expect that the genetic information will help with this, but if we have more information, we should be able to personalize that dose response to the individual. And so there are, for exercise, for example, there is a point at which it becomes too much exercise, and it could be harmful. It's been shown that exercise, part of the way that it induces health benefits is that it's putting stress on the body. And that stress could be too much for your personal health. And so if you are doing more than is good for you, you could actually be causing harm. And another example of this is in a very popular dietary regimen today, intermittent fasting, that if you take it to a logical extreme, if you're doing too much fasting, everybody is going to quickly understand that you can fast too much, right? You can fast
24/7 fast.
24/7 for, a couple of months, and you're going to starve to death.
What the real people are doing. Yeah.
And so there is a point, and with fasting, it's also similar to exercises. Part of the way that we get the benefit is it's putting stress on the body. And so if your body has problems already, you can actually put too much stress. Or just even for a healthy person, if you fast for too long, you're fasting too much, and you're going to starvation. So there is this point where titrating the interventions, even if they are preventive or like exercise, that titrating that to the individual potentially could help them. Yes, they need to do a little bit more to get the same benefit that you get from less exercise.
So Ben, you're a numbers driven guy. You prefer to be evidence based rather than just kind of jump in and be to kind of just guess with where things are. So how would you recommend to someone who maybe doesn't have access to their genome? They don't have access to a regular lab panel. How would you recommend to someone to start that titration process to figure out what's working for them? What are some potential objective measurements that you can perform on yourself, or ways to evaluate yourself?
Well, that's the $1 million question, right? There are all sorts of gurus out there that are spending a lot of time trying to convince us to do their their lifestyle and diet plan and so forth. I think it depends on who the individual is and what the current status of your health is. If you're apparently healthy, you don't have any known problems with your health, it's something that's maybe less important to actually be doing. You can try out a few things. You can vary your diet. You can vary your exercise regimen. And you can see what that is without a lot of potential risk because you're pretty healthy. For people who have developed a chronic disease or who have a major genetic risk marker or so forth, there are different levels of concern there. And so you'll want to talk to your physician and you'll want to involve health professionals in starting to assess that and get some guidance from them. And then if you're healthy enough, then maybe you can move back to doing some of the experimentation on your own. But there are these different levels where people are in their lives. And if you're older, even if you're apparently healthy, you may want to talk to your physician also and get some input to do some of the lab testing and so forth, just to be sure of where you are and that your perception of what your health is actually meets what the reality is.
Interesting. I'll just kind of like speak to that, kind of like how I've looked at myself. About 2.5 years ago, I got a Garmin smartwatch, kind of a sports watch. I wanted one for a number of years and got it with the sole intent that it would kind of be an odometer for myself. And just I could use that, track my mileage or so on when I go out for a run or a bike ride or a walk. And while I still continue to do that, and I get a lot of value from that, I get so much more value from its apparent measurements of things like heart rate variability and like a calculated VO2 max. It's not a true VO2 max, but it's sort of an estimation of what your true VO2 max would be. Some like basic metrics around sleep quality and stress levels. And it has been fascinating for me to kind of do my own little experimentations and titrating things with exercise, different sleep routines to try to improve my sleep, see what the effect is on my heart rate variability, and then just pair that with objective measurements of like, I've been feeling really good this week. And to be able to look and say, it just so happens my heart rate variability has, had this certain trend recently. I don't know if there's a true relationship there, true causal relationship, but it's an interesting correlation and it's fun to look at. And it's been really interesting. I mean, like, for example, like one thing I learned is that if I have anything sugary, like ice cream, before bed, my heart rate variability and my sleep quality go down that night. And it's almost a perfect relationship. I've tested it a couple of different times and it's been fascinating to see that. And then correspondingly, my ability to, the next day, even next couple days after an event like that, to perform well in a hard workout goes downhill. Just from something like that. So if I have ice cream tonight before bed, it's Friday night, it's possible that will happen. My wife really likes ice cream and I like enjoying ice cream with her. That could negatively impact my ability to have a good exercise workout tomorrow and potentially even the next day. It's been fascinating to look at that as a kind of an unintended consequence of getting this watch, to see those pseudo-objective measurements of my overall health. And like, they're not lab quality. There's absolutely no question about that. And I don't put much stock in the absolute measurement that the watch and the kind of the app behind it are reporting. But noticing the trends over time has been really, really interesting and potentially valuable. I don't want to, forecast my own death with it, but it's been interesting to pay attention to. I don't know if either of you have a smartwatch or any type of, wearable tracking that you use, but it's been interesting for me to look at it.
Yeah, I think that is a great example that shows that you can manage that. Well, just in general, we manage what we measure. If you're not measuring your exercise or your heart rate or so forth, it's more of a guessing game. And so these wearable devices and the technologies we have available today, or even simple step counters, anything that measures and quantifies what we are doing on a daily basis can help us to evaluate, how am I feeling today? What number of steps did I take? What's my heart rate, or so forth, whatever the measure is. And we can evaluate those ourselves. And I'm a big believer in empowering individuals to evaluate and to make decisions for themselves. That really takes the healthcare to a personal level, because you're the one actually that understands yourself the most. And if you can make those decisions on your own and be confident about it, it helps you feel more empowered to manage your health as you go forward. But yeah, in clinical quality improvement or medical, the quality of care, what people say is you manage what you measure. And so if you're measuring something, then that really it provides those quantitative data. And that's one of the reasons I'm really into quantitative information, because you can manage it if you know. But diet is a prime example of where it's just terrible to manage your diet, because for a large part it's very difficult to measure what are you eating, what's the quality of the food. There are people who count calories, but how accurate is that? It's notoriously difficult to even measure calories, let alone all the 200 or so nutrients that might be in the food. And so how do you manage the diet, when you can't really measure it well? And it takes so much time to even measure the diet on a rough level. What do most of us do? We totally ignore our diet, or we're just kind of shooting from the hip. And we really don't know with diet unless we're spending a lot of time thinking it through.
So in practice, what I'm gathering from this is, and let's stick with diet as a good example here, there might be a bunch of diets that are healthy, but according to me, my genes, where I'm at right now, one of them will have an optimal response to my health. One of them is going to make me feel the best, give me the best bang for my buck, right? So it's up to me as an individual, hopefully with my primary care provider, to kind of experiment and dive in and see what works for me. And if you have something like a watch, like David was talking about, that can help kind of guide you with actual values, objective numbers, as opposed to just your feeling. So if someone were to say like, hey, I want to try out the ketogenic diet. I know all these people who love it. My primary care provider says that it could be healthy. What advice would you give to someone who is taking on kind of an experiment to see if a certain type of diet works for them? What should they be looking for to know that it's working? What should they be looking for to know that it's not working in something as complicated as a diet?
Well, that's a great question. And again, what are you measuring? Can you measure it? It's a big question. The first thing actually I tell people about diet is it going to be safe? And some of these intense diets can put a lot of stress on your body. And so people need to do it safely. And so if you have chronic diseases, or if you're taking medications, you should talk to a physician, a healthcare provider, to understand before you start a diet, is it going to be something that's safe for me? What are the measurements? And for a ketogenic diet, there are a variety of things, such as measures of ketones, that some people will get these real-time ketone monitors that you can take around with you.
Are those accurate? Do you know?
Anything that's point of care, anything you can do kind of on the fly with a prick of your finger or so forth, is going to be less accurate than if you get a blood sample from your arm and a clinical laboratory tests it. And so you have to take it with a little bit of grain of salt. There is going to be some variation, but there are these technologies that are relatively inexpensive. If you really care about measuring these things, you can measure your ketones and see, am I getting to the level that I need to get to have the benefit I'm looking for?
So that seems like it's a lot more accurate than just having someone smell your breath to see if you have acetone on your breath. So that was the old diagnostic method for diabetes, right? To see if you have high ketone levels. So
right. Yeah.
Just smell your breath.
Yeah, you can smell acetone pretty easily on someone's breath. If you're ever around someone who's extreme with the ketone diet, you can, if you have a good relationship with them, ask to sniff their breath, and you may be able to determine the acetone there.
That's funny.
You might be getting a little more information than you want to, though.
You might.
Get up close to someone like that.
Yeah. Because there's a lot of different, as you pointed out earlier, Ben, there's a lot of different health fads, a lot of these so-called gurus that are trying to get your money, help you become healthier, hopefully. And, some of it probably works. Some of it a lot of it probably depends on your genes.
Right.
I don't know, like whether or not it's actually going to work.
Diet, there's a whole field now. Some of it's research, some of it is gurus trying to sell you information based on your genes. They'll test your genetic code and
really?
Then tell you what diet you should be on. And I think at this point, there's a lot more research that needs to be done, but I see the value myself. For example, I love cherries, and I've loved cherries my whole life, and I will eat cherries all day long. And I don't get the gastrointestinal problems that other people describe with cherries and so forth. I just love them. And I don't know what it is. And I assume that there's some kind of maybe even deficiency that cherries had something, or that I'm getting from the cherries that my body doesn't have, that other people naturally has. And so, and I can tell you there are some of my children, I have 7 children. There are some of my children who love cherries like I do. And there are some of them who do not, and they will not eat cherries as much as I do, or as these other children. So there's something potentially there that has to do with the genetic code.
And you live in an area that's famous for cherry orchards, right?
I do, yeah. And I have several cherry trees in my yard.
Oh, cool.
Yeah,
wow,
that's fortuitous.
You say there's one way to test your genes is to have kids and see what they like and don't like. Experiment on them. Like, you like cherries a lot too.
Test a lot more than just your genes.
Yeah,
that's true.
Kids.
Yeah. No.
All right, this has been fun.
Test your patience.
Yeah. Let's get to a 1 minute for 1%, because now we want to take some of this conversation and hopefully transform it into something that the listener can take home and transform into something actionable that they can do. And this time around, Dr. Benjamin Horne is going to give that to us, so I'm excited to hear it.
Thanks, Will. It's been fun to be on the podcast, and I think we've talked a lot about risk, about measuring risk, about using genes or other common clinical medical factors and so forth. And it's really interesting because each one of us has some level of risk, and for some people it's higher, and hopefully in the future we'll be able to measure that precisely. But it's really interesting. Back in 1986, a group of scientists and physicians from the University of Utah published a paper in the Journal of the American Medical Association where they did some pedigree analysis of people who were living then or who had lived in the recent decades, and they compared the risk of having a heart attack or of dying from heart disease to their ancestors. And they found that people in the recent years, when food has been so abundant as in the 1900s and the 2000s to date, they found that those people were dying. They were having heart attacks on average about the age of 42, and they were dying at the age of 45. These people had a rare genetic mutation for familial hypercholesterolemia. So it's something that is causing some very bad outcomes for people with this mutation. It's a very uncommon mutation, but for those that have it, it imparts a very high degree of risk. In comparison, their ancestors who lived in the 1800s, some of them were living into their 60s, their 70s, and even one of them into their 80s. And so there were lifestyle factors that were different back in the 1800s when food was more scarce, that they were able to live for a much longer period of time based on having a different lifestyle. And so that's something that I think is really important for us today, that even for genetics or for factors where it's giving us high risk, we can all have hope that changing our diet, changing our physical activity, other choices and lifestyles we have can help us to live a longer, healthier life and have be able to be around for longer with our family and to do the things in life that we want to do and to benefit our neighbors to live in a happy society. So appreciate the time and being able to participate with you today.
Ben, thank you so much. This has been wonderful to kind of sit at your feet and learn from your decades of experience working in a very complex field focused on a very objective approach to health and being able to really understand where you are from an objective perspective rather than just subjectively waking up and saying I feel great or I don't feel great. So this has been eye-opening to me.